Hello. If you or loved one has cancer and worry about what type of treatment is suitable for you in order to gain your normal life without fear of recurrence, I have a good news for you. I am Dr. Khansari, professor of immunology, who has worked more than 2 decades to develop and apply an alternative therapy to chemotherapy for cancer. Chemotherapy is done using cytotoxic drugs that kills not only cancer cells, but normal cells as well. Consequently, patients suffer from general toxicity and weakness of the immune system because of the white blood cells, which are responsible for body's defense against infection and cancer, are very susceptible to chemotherapeutic agents. This side effect of chemotherapy often expedite the course of disease advancing toward the terminal stage. Patients who use my consultation depend on the stage of their disease. I often recommend not to go through chemotherapy procedure. The best alternative therapy that I recommend, based on my own research as well as those of many world-renowned research groups, is use of endogenous immunomodulator immunotherapy as an alternative to chemotherapy or radiotherapy. What is endogenous immunomodulator immunotherapy? It is use of immunomodulators that exist in the body and has a physiological role in healthy individual, but in a small amount. Immunomodulators have different roles depending on their concentration in body. This means by adjusting dose, we can apply them in different conditions, such as potentiating immune system to fight cancer or suppressing immune system to fight against autoimmune diseases like MS. By applying endogenous immunomodulator immunotherapy following surgery and removal of tumors, oncologists try to potentiate the defense mechanism of the body to fight and remove remaining cancer cells could not be removed by surgery. This type of post-surgical treatment is not as toxic as chemotherapy and potentiate immune system to get rid of cancer cells remain in the body after surgery. Thus, chance of recurrence of the tumor would be minimal to none. Because of the nature of endogenous immunomodulator immunotherapy, which is safe and sound, oncologists are considering to apply this procedure to their patient with confidence. The only drawback for this type of therapy is high expense and need for highly skilled personnel to prepare reagent and apply to patients. We hope to overcome these drawbacks as such that endogenous immunomodulator immunotherapy can be administered in physician office with reasonable expense and more effective in the near future. Thank you.